Hi, Mr. and Mrs. Carter. It's so nice to meet you. My name is Amanda Lovell. I'm one of our speech-language pathologists here at the clinic. Hi. So first of all, I wanted to thank both of you for coming in today. And I also wanted to thank you so much for bringing Susan to come see us. We had a great time with her this afternoon. I did want to sit down with the two of you now and talk about Susan's test results. We did some assessments and we did evaluate where Susan is with her speech, and I wanted to tell you about that and kind of explain it to you and allow you to ask me some questions so there's no confusion. And then I kind of wanted to touch on where I think we should go from here, therapy-wise, and I also wanted to get input from the two of you about how you'd like to proceed. So we did do an assessment test to evaluate where Susan is phonologically, and that just means that we assessed the sounds that she's currently able to use. From these test results, we determined that Susan does have a pretty severe phonological processing disorder. That just means that she has a difficult time organizing the patterns of the sounds that she wants to use in her head, in her brain, and so she doesn't form these sounds correctly, the sounds of the letters and words, when she does speak them aloud, which is why her speech is so unintelligible a lot of the time, which Mrs. Carter was one of your large concerns and one of your reasons for bringing Susan into the clinic. So our main goal for Susan is to improve that intelligibility, and I think that that's definitely an attainable goal. I recommend that in order to do that the most efficiently, she come in for therapy at least twice a week for a 45-minute session each time. I also wanted to kind of tell you about the approach I think would be best for Susan during the actual therapy sessions. I'd like to use something called the cycles approach to structure each of these therapy sessions that we'll have with Susan. I do have a visual representation of each of the parts of the cycle, kind of the different stages that we'd go through each time. If you want to take a look at that, yeah, of course. Here you go. And feel free to ask me any questions about any of those terms on there that you don't understand. Absolutely. This specific approach, the cycles approach, I think would be excellent for Susan because it was designed for children with phonological disorders who do have pretty highly unintelligible speech. It's also designed to improve that intelligibility within a relatively short amount of time. So that would be anywhere from 5 to 16 weeks, depending on Susan's progress, you know, how much you think it's helping her, how much we'd like to see her, and what we think she needs to work on. And you two will be a very large part of this. It's so important to facilitate these skills she's learning here at home. And the great thing about at-home intervention is that you can do it just about anywhere. So you would pick kind of a sound that Susan is having trouble with, like g, you know, in dog, and find opportunities to point that sound out in any kind of everyday activity that you do. So point it out, ask her questions about it, try to get her to say it. And that can be done anywhere: playground, making dinner, reading a book, anything like that. Now, if you have any questions for me, I'd be happy to answer them.